friends, today I'm going to be showing you a more comprehensive kinesiology taping for belly support during pregnancy. A few things to keep in mind: you'll want to start with clean, dry skin, no lotions or oils on the skin. If you are sensitive to adhesives or haven't tried this taping before, you might want to do an allergy test, specifically on the stomach. The skin on the stomach can be a little more sensitive than skin in other areas of your body, so make sure that you're not going to have a reaction before you apply tape all over it. And it is helpful to have all of your materials on hand before we begin. This application will require 4 to 5 strips of pre-cut kinesiology tape. My strips are about 5 to 6 inches in length with rounded edges. You're going to begin by taking your first strip and tearing about a 1-inch piece of the backing from the bottom of the strip. Peel that backing off. We're going to apply this low. We're right by the pubic bone here, so I'm going towards the front of my stomach and laying that anchor down without any stretch, and just give it a little rub. Next, I'm going to peel the backing off of the strip, leaving just a little bit on the edges for me to hold on to. And I'm going to apply quite a bit of stretch in the tape and lay this down along my abdomen, coming up towards my chest bone. When I get to the end, I'm leaving again about 1 inch for my anchor piece, and that last little bit of tape that I lay down, I'm going to apply without any stretch at all. We'll repeat this process by tearing a 1-inch anchor backing off of the paper tape. I'm going to apply the tape without any stretch to the area right near our pubic bone. Then peeling off a good portion of the paper backing and applying lots of stretch to the tape as I lay the tape down along my abdomen, coming up towards my sternum. My last inch or so, I am just going to peel the backing off and lay that down without any stretch. The tape is somewhat heat activated, so a little bit of rubbing is going to help it secure and adhere to the skin. My next piece of tape, I am once again going to tear off about 1 inch of paper for my anchor piece. And I'm going to lay this down towards my back without any stretch. And this piece of tape is going to be applied right along this crease between the stomach and the hip here, just following along the trochanter of the hip. So I'm going to peel off the paper backing, leaving just a bit on the end to hold on to, and applying a good amount of stretch here to lay this down, following that natural crease in the hip. When I get to the end, again, I'm reaching towards my pubic bone, I am going to apply that last inch without any stretch to the tape and just lay it down and give it a rub. And what you do to one side, you want to repeat on the other side. So peeling off a 1-inch anchor piece and placing that anchor down towards your back. Then peeling the paper backing and applying a fair amount of stretch to the tape, following along that inguinal crease here until you reach towards your pubic bone. And then the last inch of tape, you're just going to peel off the backing and lay it down without any stretch. Depending on how far along you are, the 5th piece of tape is the optional bit of extra support. Some women might find that the tape coming from their back is not reaching all the way around to their pubic bone and is stopping quite early, or they might just find that they are still feeling a little bit of discomfort in the anterior pelvis. So having one more piece of tape can be useful for that extra bit of support. For that, I would just tear the tape backing down the middle and begin to peel the backing off. Apply a good amount of stretch and then place this over the pubic bone area with lots of stretch, allowing no stretch on the ends as you peel that backing off. That is comprehensive kinesiology taping for later in pregnancy. I hope that you found this application to be useful, and if you did, I would so appreciate it if you'd share this video with somebody else who might benefit from trying it. Thanks for watching.